Hi, this is Dr. Kavanaugh coming to you for Room Now, and I'm at ACR Convergence 2022. It's a big meeting, a lot of information, and of course a lot of scientific abstracts, and I think that's what most of us like. I'm talking about psoriatic arthritis, and the abstract I like to talk about now is abstract 1600. And this is the impact of second-line therapeutic changes on disease control after discontinuation of the first-line TNF inhibitor in patients with psoriatic arthritis. And this comes from the CorEvitas, previously known as Corona Registry, the PsA SPA registry that they have. So it's an interesting analysis that looks at PsA patients who had been on a TNF inhibitor, first line, and then were changed to another TNF inhibitor, they call them cycling, or switched to a different mechanism of action. These are great data. I always say that PsA is lagging behind rheumatoid arthritis by about 10 years. We've seen these studies in rheumatoid arthritis, and I think they're a good source of information of practical data that we as clinicians can take to our patients and present them with information to help them make the best choice. In this case, the cyclers did well, and by and large, but you could make the case that the changers, those who went to a different mechanism of action, did seem to do a little bit better. Of course, always the devil is going to be in the details, and we'd love to know what specific patients could possibly cycle from one TNF to another, as opposed to those who should go to a different mechanism of action. And there, the involvement across domains of disease, I think, is going to be very important in making that decision, also important in the choice of subsequent therapy. So interesting data that does help inform us, I think, and the more we learn, the better we'll be able to present therapeutic options to our patients to get them better. So this is Dr. Kavanaugh for Room Now, coming to you from ACR Convergence 2022 in Philadelphia. Thank you. Hi, it's Dr. Kavanaugh coming to you from ACR Convergence 2022 in Philadelphia. It's been a very busy meeting, a lot of interesting papers as always, and it's good to be back in person, to be able to interact with people. The abstracts I'd like to cover are in psoriatic arthritis. One I'm going to present right now is a late breaker 02, and this is from the Be Optimal study. This was a study of bimekizumab, the IL-17A and IL-17F inhibitor, compared with adalimumab and then also with placebo. So it's an interesting study that we like. It's not powered strictly to be a head-to-head study, but we are able to compare the data. At 16 weeks, what we saw was that the bimekizumab and the adalimumab arm were superior to the placebo. We had seen those data before. At 16 weeks, the bimekizumab 160 milligram group continued. The adalimumab group switched to the bimekizumab at week 16, as did the placebo group. Then they were followed out over time. Interestingly, at the endpoint of the study, the ACR 50 response is pretty similar. 54.5, 50, and 53 across the original bimekizumab group, the original adalimumab group, and the original placebo group, all of whom are on bimekizumab now. And the MDA response is very nice, 55%, 53%, and 53.7%. So I think these studies, I love studies that give us the ability to kind of take a look at different mechanisms of action. I think we're looking at appropriate goals like minimal disease activity, and it's interesting data. I think with the bimekizumab, we have to see, are there going to be differences to the other IL-17 inhibitors in terms of either efficacy or safety. So very interested in seeing additional data from this. A great presentation at the ACR, and this is Dr. Kavanaugh coming to you from Philadelphia, ACR 2022 Convergence for Room Now.